Hello, and welcome back to my YouTube channel. Today we're going to be talking about the way that we use the English language when we discuss the coronavirus or the COVID-19 pandemic. Now obviously this is a conversation that we have on a daily basis, so it can really help you to learn how we use words in English to talk about this issue. We're going to look at some of the vocabulary about coronavirus and some of the verbs that we use when we talk about this kind of a pandemic, the phrasal verbs, collocations, and some common expressions about pandemics in general. So these words and verbs and phrasal verbs and collocations aren't just about coronavirus. They're used in this context when we talk about healthcare issues or global politics, and can be useful for you in a lot of different contexts. So this lesson is just like the other lessons that I've put on YouTube. There's a PDF that you can click on a link underneath the video and download the PDF and use it to follow along with me as I'm giving the lesson. And there are going to be activities on it that you can do after the lesson to help you learn the words and learn some new vocabulary. So click on the link and get your PDF. Follow along with me. I'm going to begin by giving you a brief history of the pandemic. And the information won't be new to you, but I want you to listen really carefully at how I use English words to discuss this topic. So sit back and relax and let me tell you a story. In late 2019 and early 2020, the world experienced an outbreak of a strange new flu-like illness. Cases of this new sickness first crept up in the Wuhan region of China. To doctors and other healthcare workers, this new sickness appeared to be a respiratory infection because patients suffering from it reported experiencing symptoms such as coughing, high fever, shortness of breath, and runny nose. Other people contracted the virus but were asymptomatic, meaning that they displayed no visible symptoms. These people were only carriers of the virus and could transmit it to others, although they were not sick from it themselves. Soon after, new cases were reported in other parts of the world. The number of cases rose quickly and grew exponentially. Eventually, the outbreak had become so widespread that it was labeled a global pandemic. Many countries around the globe instituted protective measures intended to stem the spread of the virus. These measures included lockdowns, quarantines, and curfews. Restaurants, bars, and shopping centers around the world were forced to close as the government scrambled to stem the spread of the virus. Many governments also mandated that people wear masks in public and submit to testing. For many people, working remotely and staying in at night on the weekends became the new normal. Scientists working for governmental agencies and pharmaceutical companies around the world raced to develop a vaccine to combat the virus. The vaccine would inoculate people against the virus and allow life to return to normal for most people. And currently, many people have gotten vaccinated. Unfortunately, there have been a couple of setbacks in the global effort to return to normalcy. New strains of the virus have popped up in different parts of the world. First, there was the Delta variant that appeared in India in 2020. It has spread to many countries around the world. Then came the Lambda variant, which originated in Peru. It has spread across Latin America and into the United States. Both strains of the virus are concerning because they are more contagious than other strains of COVID-19 and may be more resistant to vaccines. Although many people have died from the virus and it continues to spread, the vaccines have offered us renewed hope. The virus may be here to stay in the long term, like the common flu. But we may be able to control it better and go on to live with it indefinitely. First, we're going to look at the vocabulary, some of the words that you may have heard in the little story that I just told you about COVID-19. One of the first words you may have heard was the word outbreak. Outbreak is a word that we use to talk about the beginning of some big event like the pandemic. We can say that the outbreak of COVID was in 2019. You can say that there was a recent outbreak of malaria in some part of Africa, or there was an outbreak of the common flu in the United States. It's just when you start seeing new instances of this happening. You also hear this word a lot in the context of war. For example, you might hear somebody say that the outbreak of World War I was in 1914. That's when you first started seeing people fighting that war. So that's the word outbreak. Another word you probably heard was cases. Now, cases refer to the individual instances of something like an illness. So if I had the COVID-19, then the doctors would say, well, this is another case of COVID-19. So that's what they mean by cases, each individual instance of something like a sickness. Another word you probably heard was healthcare workers. Healthcare workers are the word we use to describe anybody who works in the healthcare industry, like doctors, nurses, emergency medical technicians. Those people are all healthcare workers. Now, another important word that you probably heard was the word symptom. Now, symptoms are the things that happen to people when they get an illness. Like COVID-19 makes people cough, and it makes people have a high fever, and it makes them have a runny nose. Those are symptoms. You can look at that and say, well, he's got a cough, a high fever, and a runny nose. He might have COVID-19. Another word that you probably heard was the word asymptomatic. Asymptomatic means that somebody has the COVID-19, but they don't have symptoms. They carry the virus, but they can't. They don't feel sick themselves. Another word you heard probably was the word global. Okay, COVID-19 is a global pandemic. The Earth is a globe. A globe is a round object. Okay, and the Earth is a globe. And so when they say that something is global, that means it's all over the world. Like the internet is a global institution. It goes all over the world. Another word that you heard was protective measures. Protective measures are things you do for security. Some protective measures you do probably in your home are you lock your doors and your windows at night when you go to bed or when you leave in the morning to go to work so that someone doesn't break into your house. That's a protective measure. And some of the protective measures that the governments around the world asked people to do were lockdowns, quarantines, and curfews. So a lockdown is when the government tells people, don't leave your house. Just stay in your house, okay? We don't want people, the more people go around in the community, the more the virus spreads. So everybody, please just stay at home. Another protective measure that they ask people to adhere to is curfews. A curfew is when the government says you can leave your house from 8 a.m. in the morning until 7 p.m. in the evening. But after 7 p.m., between 7 p.m. in the evening and 6 a.m. in the morning, you have to stay in your house. That's a curfew. If you're out in the street past 7 p.m., you might get in trouble. And then a quarantine is when someone has the virus or has been exposed to the virus. They're forced to stay in isolation, meaning they have to go to their home or go to a hotel and stay in there and not leave that place for, normally I think it's 2 weeks, okay, that people have to stay in a quarantine. Okay, but that's something that is specific to you. A lockdown is something that the government asks the population to do, meaning everybody stay in your house. But if you have the virus, you would be quarantined. Now, a very common word you might hear today are strains or variants of the virus. Now, a strain is a mutation of the virus, and it's a synonym of the variant. So you hear now a lot of places in the world have a problem with the Delta variant or the Delta strain of the virus. That's what that means. It's genetically almost identical to COVID-19, but it's just a little different, and so it might make it a little bit more dangerous. Okay, but that's a different strain or variant of the virus. And one of the problems with Delta and Lambda variants is that they are more contagious, meaning that if something's contagious, it spreads more easily from person to person. And another problem with these new strains is that they can be resistant to the vaccines, which means that the vaccines may not be effective against them. Their genetics give them defenses against the vaccine, and so they are more resistant. So those are some words that you may have heard that maybe some of them you didn't know or you didn't know exactly what they meant. Hopefully that clears it up for you a little bit. And next we're going to look at some of the verbs that people use when they talk about this issue. There are several verbs that you hear a lot when people talk about the coronavirus, but they're actually not unique to the pandemic. They're used in the medical context a lot. For example, the first verb you may have heard was the verb to display. The verb to display normally means to hold something up so that people can look at it or observe it. And in this context, we say that people display symptoms of the disease, which means that you can look at them, you can observe them, and see that they're coughing, or they have a high fever, or that they have a runny nose. They're displaying symptoms of the virus, and you can conclude that they might have the virus. Another verb that you heard was the verb to transmit. To transmit literally means to pass something from one person to another person. In this context, it just means to pass the virus from one person to another person. That's how it spreads. Another couple of verbs that you probably heard were the verb to rise and the verb to grow. We say that cases of the virus are rising. That means statistically the cases are increasing and going up. Or you can say that the virus, the pandemic, is growing, which means that one person is passing it to the person around them, and those people are passing it to the people around them, and those people are passing it to the people around them, and it keeps going all over the world. So cases of the virus rise statistically, or they grow exponentially. Okay. Another verb you probably heard was the verb to combat. To combat is actually literally means to fight. You hear it mostly, obviously, in the context of war. War has combat. People fight and they get killed. But in this context, people are talking about combating the virus by using protective measures and the vaccines. They're doing those things to fight the virus. And another verb you may have heard that maybe you didn't know before was the verb to inoculate. To inoculate is basically to give somebody the vaccine, to make them, to give them a defense against the vaccine. So that's the verb to inoculate. Now, here's the thing to remember, that you can inoculate someone else. You can give them the vaccine and they will be protected, or you get inoculated. So in this case, if it's you, it has to be in the passive. So those are some simple verbs that you may have heard, maybe you didn't know before. Hopefully you found them useful. In the next part, we're going to talk about some of the phrasal verbs you may have heard. There are a few phrasal verbs here that are good to know. The first one that's good to know is the phrasal verb to creep up. To creep up means something happens or it shows up unexpectedly and was a complete surprise. That's what happened here in the coronavirus. Cases started creeping up and people weren't aware of it. Everyone was surprised by it. Nobody knew what it was, and we had to figure out what it was. And so the coronavirus crept up and the cases started creeping up. No one was ready for it. Another phrasal verb that's good to know is to stay in. To stay in is almost the opposite of the phrasal verb to go out. To stay in means you stay in your home rather than going out to eat dinner in a restaurant or going to a movie or going to work. During the lockdowns, everyone had to stay in because the restaurants and bars and theaters were closed. And the third phrasal verb here that's really interesting is the phrasal verb to pop up. Now, pop up is similar to crept up, only when something pops up, it's not really a surprise. For example, here, the new variants of the virus have been popping up around the world. It's not a surprise because that's what viruses do, they mutate. So scientists knew that that was going to happen, but they pop up, meaning that even though we know it's going to happen, we don't know where or when it's going to happen or what it's going to look like. So in this case, the new strains of the virus have been popping up, and it's a problem. So those are three phrasal verbs from the history of the coronavirus that I hope you find useful. There's also a few collocations and expressions that you hear a lot when people talk about coronavirus that are really good to know. The first one you may have heard was the expression to stem the spread. Now, to stem the spread means to slow down the spread of the virus. It doesn't mean to stop the spread of the virus, it just means to slow it down. That's to stem the spread of something. Okay. Another one you've heard, that you probably have heard before, is the expression working remotely. That's what most people who work in an office are doing now. They're working remotely, meaning they're working on the internet from their house. Another one that's good to know is the new normal. And that means that something that wasn't normal before is now what is normal. And now working remotely has become the new normal for a lot of people. The next one is a collocation that's very good to know, and that is to get the vaccine. So I talk to students all day, and they're often confused about how to express the idea of receiving the vaccine. In some languages, they say to put the vaccine or to vaccine. But in English, you say you get the vaccine. Or you can say you get vaccinated. Okay? But if you say it that way, it needs to be in the passive. You get vaccinated. Now, you can vaccinate someone else. But that's in the active. You do it to someone else. But when you receive the vaccine, you get vaccinated. Another expression that I really like is the expression renewed hope. So renewed hope is an expression that means that we were going through a difficult period, but something happened that made us a little more optimistic about the future. So that is renewed hope. And in this context, we mean that the vaccines have given us a hope that in the future our lives might become more normal than they were in 2020. And the last collocation you need to know is submit to testing. When you voluntarily allow yourself to get tested for COVID, you are submitting to testing. And that's the way we express that idea in English. So I hear a lot of students get confused by that. So now you can get tested for COVID, but a lot of times you'll hear English speakers say that they submitted to testing. So there you go. Those are some common vocabulary words and verbs and phrasal verbs and collocations that we use when we're talking about the COVID-19 pandemic. Once again, I hope you got your PDF and you do those activities and learn these words. And if you have any questions, you can send me a message in the YouTube channel. And if you liked today's lesson and you thought it was useful for you, please hit subscribe to my YouTube channel, or scroll down here and hit subscribe in the bottom of the screen. And whatever you do, I hope you enjoyed the lesson, and I hope it was useful for you. And please take care, and good luck to you. And I'll see you in my next YouTube channel.